Hey guys, today I'm back with another mock USMLE question. This is going to be question number 15. So the question is, you have a 65-year-old female, past medical history is notable for CVA with the residual left-sided weakness, who comes to the ED with acute onset chest tightness. Patient states that the chest tightness began about 3 hours ago and states that her symptoms are worse with exertion. In the ED, patient was administered nitrates, which provided modest relief. Otherwise, on vitals, patient's temperature is 36.4, blood pressure is 109/72, pulse is 85 beats a minute. On physical examination, patient appears to be in moderate distress. And then on cardiovascular examination, patient has a normal S1, S2 with no murmurs auscultated. You obtain an EKG, which I'll show in 1 second. And the question asks, what is the next best step in management? So let's look at the EKG first, and then we can go over the options. So this is the EKG. Take a second to pause right here so you can look at the EKG. So going back to the question, once again, the question is asking, given the EKG findings, what is the next best step in management? And the options are IV alteplase infusion, giving the patient aspirin 325, starting a heparin infusion, or doing an emergent PCI. If you need more time, go ahead and pause the question. The correct answer is doing an emergent PCI. So looking back at the EKG for a second, what this EKG demonstrates is that you see ST segment elevations in multiple leads, including 2, 3, and AVF. What that's consistent with is a myocardial infarction in the inferior distribution, a STEMI in the inferior distribution. So whenever you see a patient with a STEMI, the first most important step that you have to do in that situation is you have to immediately get in touch with cardiology, and this patient needs to go under an emergent PCI procedure. And in a PCI procedure, what a cardiologist will do, and actually it will be an interventional cardiologist, will look at the blood vessels of the heart and see which blood vessels, if any, are occluded and how occluded they are. Based on the results of the PCI, the cardiologist will generally do one of two things. One is if there are multiple vessels that show a lot of occlusion, in that case, generally, the cardiologist will recommend consulting cardiothoracic surgery for a CABG. Now, if there's only one or two vessels which show a lot of occlusion, in that case, what cardiologists will be able to do is put in a stent in the vessel that's occluded to open up that vessel. But regardless, it's very important to remember that the minute you see a ST segment elevation MI on EKG, immediately contact cardiology to do a PCI procedure. And through that PCI procedure, they'll be able to see which vessels are occluded and how occluded they are. And based on that, they can take the next steps in terms of putting in a stent versus putting in CABG. With regards to the other options, so option A, IV alteplase infusion. So if a patient presents with a ST elevation MI in a facility which isn't capable of producing in a facility that isn't capable of doing PCI, in that case, you would do a thrombolytic like alteplase. But if a patient comes with a STEMI in a facility that does have cardiologists where they are able to do PCI, the first step is to do a PCI. Looking at option B and C, aspirin and heparin, these are all things that eventually you want to start the patient on. But remember, the first thing, the minute you see a STEMI, I've repeated this several times just to emphasize how important it is, but the minute you see a STEMI, call cardiology, get a PCI. Other options are great, but that should be your first step. Next, I wanted to go over this mnemonic. This is something that I think a lot of people are aware of, but Monobash refers to what are the things that you want to do when you have a patient with ACS. And this includes both STEMI and NSTEMI. And this mnemonic, I think, is great, particularly for medical students who are preparing for their clinical rotations, in terms of what things patients should be started on, what medications patients who have undergone ACS should be started for. M in Monobash stands for morphine. So you want to give patients something for pain relief. O, oxygen. You want to give them supplemental oxygen and make sure their oxygen saturation is above 92%. N is nitroglycerin. A is aspirin. Aspirin inhibits platelet aggregation and can prevent further thrombus formation. B, beta blockers. Beta blockers, their main function is reducing the strain that's put on the heart, which will hopefully decreases further damage to the heart. A, the second A in Monobash stands for antiplatelet agents like Plavix or Prasugrel. This once again prevents further thrombus formation. S, statins. Statins medication help reduce the lipids in your body and once again help fight against plaques. And then S in Monobash stands for heparin, which once again prevents further clot formation. So the key takeaway that I want you to have is whenever you have a patient with a STEMI, the first step is do a PCI. And there are a lot of other things you want to do, but once again, the first step will be to do PCI. And this Monobash mnemonic, just memorize this slide because these are all the things you want to do whenever a patient has an ACS. These are all the medications you want to start the patient on and how you want to manage that patient. So I think that's going to be it for today.